It was middle of the pandemic, June of 2020. Remember, it was just like a Wednesday morning. We were outside maybe like 10, 15 minutes, about to walk back inside. And before I knew it, like the window behind me went up. It was like 2 windows went up like really fast. And by the time I like stood up and looked at him, you could just tell, no good. You know, I could just see it in his eyes. And so I remember getting like 15 feet away from him. I turned back around and he's crouched down and holding his posture like he's holding something like big. I was like looking at him like, are you aiming something at me? And after that, it was just like, the next thing I remember is it felt like I was waking up on the boxing mat. The 2 main injuries were bullet entry on my right side, which decimated my femur, and just I would say the left side, which was soft tissue, like hip area, but it's both sides of your body. Had my left hip looked like my right leg, I don't know if I would have been able to walk, or some of those areas would have been repairable. So I lost like 75% of my blood volume. And within that time, you think about everything. Like it was like all such a surreal experience. Then I remember a couple of paramedics coming up to my aid, and I remember being like, am I gonna die? They'd be like, not here. Even like the people wheeling you in, like, not here. And it's because 1, they see a lot of people come in and not die. But 2, I think a lot of people here are confident that they have the tools, the team, the assets to save lives.
Because we deal with the most severe of injuries, our surgeons have developed real expertise in dealing with the hardest of the hardest cases. So this was a femoral shaft injury caused by a gunshot wound. This was a very high velocity gunshot wound. So his femur bone had basically disintegrated. We actually 3D printed a cage, which is a modern plastic implant that goes in the middle of his thigh bone to contain all the bone graft that ends up filling that void. So he now has a nail, a plate, a cage that is made of modern plastic technology, and bone graft that is integrated in his thigh bone.
I'm glad I was brought to Denver Health because I survived. When I look back at it, if I felt like I had been brought to any other hospital in the area, I don't believe I'd be here right now. Aside from the physical journey at Denver Health, I'm thankful for the behavioral health that I've also received here. I have a team of professionals like I did at orthopedics, same thing in the behavioral health, which helped because I had no idea some of the things that were holding me back mentally that change your physical structure of your healing. I mean, if you ask Dr. Moffrey, he's like, I can only do so much physically, and then it's up to your mental health to carry your body on. You know I felt safe. That was one thing. I know I felt like I was in good hands. I always got like an optimistic answer of, we got you. And even when things didn't look great, it's like, we got you. So I feel really confident that I ended up here. I think when you go through something really traumatic and you come to terms with a near-death experience, like I could have been gone yesterday. So tomorrow's a blessing.